Hello, I'm Dr. Humaira. Today I will be presenting the brief of our research title, Implementation Research in Health Campaign Effectiveness, a retrospective study in immunization-related campaign integration in Bangladesh. In this presentation, we will discuss about the background, study objectives, methods, results, promising practices of integrated health campaign, lesson learned, and implication for policy practice and future research. Let's begin with the background. Since 1995, Bangladesh has a long history of successful vaccine preventable diseases campaign through its national expanded program on immunization platform, that is EPI. This EPI gained momentum during the National Immunization Days during NID for polio eradication. Bangladesh achieved polio-free status by successfully conducting 21 NIDs between 1995 and 2014. Government of Bangladesh used this NID platform for National Vitamin A campaign and deworming treatment. This is a wonderful example of campaign co-delivery. This platform is also used for measles rubella, sharing most of the NID components. The integrated campaign strategy led high coverage for OPV, MR, vitamin A, and deworming. However, no more NIDs are being conducted. Both vitamin A and deworming campaigns have their separate entities and still shares few components. Although this strategy was very successful, the lesson for its challenges and the learnings have not been analyzed and documented. Therefore, this study aims to identify the success and challenges of these campaigns along with the best practice, lesson learned, and recommendation about strengthening future public health intervention through integrated campaigns. The study was conducted in Rajshahi Division as high-performing area for immunization, Chattogram Division as low, and Sylhet Division as middle-performing area according to the Coverage Evaluation Survey 2014. From each division, one district and one city corporation were covered. The research questions were: what were the contexts that lead to vaccine preventable disease vaccination campaign to be integrated with other health campaigns? What were the enabling and hindering factors? What were the effects of integrated health campaign on service delivery outcomes? What are the components of integrated campaigns be applied to strengthen future public health program in Bangladesh? In this study, we choose a sequential explanatory mixed method design. At first, a group of 4 reviewers conducted a scoping review on integrated health campaign implementation in the field of immunization in low and middle income countries. Then a stakeholder workshop was held where government officials from EPI, Communicable Disease Institute of Public Health and Nutrition, civil surgeons, chief health officer, and other partners were present. The participants shared their experience and thoughts on the research topics. Next, a quantitative study was conducted with individuals directly involved in NID for a minimum of 6 or more months. The survey was also used to identify potential interview participants. KII and IDIs were conducted among respondents identified from the survey data considering the experience and expertise in campaigns. We also included persons nominated by survey respondents. The survey questionnaire and the interview guideline were designed and the data were analyzed based on the REAM framework, which addresses 5 dimensions including reach, effectiveness, adoption, implementation, and maintenance. Throughout the study, the COVID-19 rollout has been going on and all our study participants were having a busy time. Therefore, we had a challenge of getting them on board. We also might have missed some of our valuable respondents for the same reason. Now the results. For scoping review, 23 articles were included in the final review. In the survey, we got total 272 responses. We have conducted a total of 18 KIIs with persons worked intensely with the campaign and 32 IDIs with the field staff. Now let's continue the result according to the reviewing domains. Under reach, we have found the government started integrated campaigns targeting the under 5 population to make the Bangladesh polio-free and improve vitamin A and deworming coverage. Almost all the survey respondents agreed that the implementers reached the target population. Although the campaigns were implemented widely, some children were often missed. The study found that initial hesitance and misconception about the vaccine, how to reach areas and population, were the main reason that left unvaccinated children even after routine immunization and campaigns. For effectiveness, the study revealed that the respondents were satisfied with the integration of health campaign as it was effective according to the study. The top reasons were easy accessibility of the beneficiaries, improved health knowledge, time saving for the beneficiary, building trust among the service provider and community. The in-depth finding showed that the OPV coverage increased so much that the Bangladesh managed to stop the polio by 2006. They also mentioned that the campaign provides one-stop service of multiple interventions, saving costs and time. For adoption, 75.2% survey respondents and volunteers were recruited. 57.26% said training was provided. 50.42% informed microplanning was done. Qualitative study tells the field staff faced huge workload. Therefore, the government trained and mobilized millions of community volunteers, including teachers, religious and political leaders, students, and various NGO members. But it was said that they received a little incentives. A 4-day child-to-child search was added for identifying and vaccinating the left-out children. Under implementation, both the respondents mentioned that the government of Bangladesh was at the forefront in implementing the activities related to integrated health campaign. The major development and implementing partners were WHO, UNICEF, Gavi, and BRAC. The campaigns were smoothly implemented through the strong leadership by government along with the different relevant ministries. Micro planning was done to reach all the communities. NIDs were conducted mostly in the school as fixed sites, and then house-to-house visits were done according to the micro planning. In urban areas, NID were conducted through the local NGOs. To reach the certain hard-to-reach areas, both even military helicopters were used and the campaign days were increased. During NIDs, massive social mobilization efforts done to make it looked like a festival day. Announcement through the loudspeaker and mass television and radio and appeals by influential people, banners, posters, decorations were used to attract the people. Press conferences were also done. For maintenance, most survey respondents mentioned that the campaign was implemented according to the initial planning and strategy. The survey respondents reasoned community support and acceptance, cost effectiveness, and political support for NID continuation. The core respondent also identified the polio elimination target as a cause of campaign continuation. After achieving polio-free status in 2014, NIDs are not conducted anymore. But the vitamin A campaign is being conducted independently using the same platform and deworming campaign targeting school children. We asked the survey respondent why health campaigns should be integrated in the future. They said mostly for reaching target population and saving cost. In this study, we have observed few promising practices that were infrequently applied in the campaigns. The study found that the multi-sectoral approach accelerated NID activities by Government of Bangladesh with strong political commitment, interministerial collaboration, technical support from partners and NGOs, and community participation. Second is the community engagement. Spontaneous community acceptance and participation was a significant success for NIDs. The study showed that involvement of religious leaders and providing examples during inauguration were successful approaches in campaign activities to increase awareness. Then microplanning is one of the best practices for the grassroots level worker is to reach every community. It allowed health workers door-to-door access in the community through interpersonal communication. Then last but not the least, the API platform. Through this study, the lessons we have learned are integrated health campaign is the most convenient approach to improving coverage for other intervention. It also acts as a one-stop service, saving time and improve community acceptability and trust. Strategic planning, political commitment, collaboration, and coordination at all levels necessary to integrate the campaign. Sufficient resources are also necessary. Implementation factors, including the context, flexible planning, sufficient workforce, training, incentives, and monitoring support should be considered. The respondents suggested campaigns for deadly emerging diseases are and when the vaccines are not available or when the vaccine is free to the ordinary people, and sometimes campaigns like nutrition-based and vector-borne disease campaigns could be integrated in the future. Bangladesh is setting up example to the world for COVID-19 vaccination campaign. Therefore, it would be interesting to know about the factors contributing this success, also whether it follows the lesson learned of NIDs. So the key messages could be co-delivery or collaboration of campaigns are proved to be effective and efficient in achieving desired health goals. Therefore, they are preferred, especially in LMIC context. Bangladesh can utilize the established EPI platform for future integration. The promising practices and lessons learned from the NID campaigns can be applied to future health programs and other sectors as well. Thank you for your patience hearing.